When someone discloses to you that they use cannabis, a door opens. They're not just telling you they use, but also that they trust you with the knowledge of their use. As helping professionals, we know that the way we respond can have a significant impact. Being aware of how stigma persists despite legislation and taking steps to reduce it is crucial to keeping this door open. Harm reduction gives us strategies and tools to have better conversations with clients about cannabis use. Harm reduction recognizes that each individual is the expert in their own lives and that our role as helping professionals is to meet people where they're at. A key way to do this is to become fluent in the ways in which stigma around cannabis use affects our patients and clients, and to develop techniques that eliminate stigma from our practice and from our community in general. We know that the reasons people use cannabis are varied and diverse. They may use it to relax, relieve stress, manage pain, feel more creative, help with sleep, the list goes on. In order to confront the stigma surrounding cannabis use, we need to know what the evidence says. How are people actually using cannabis, and how is this different from the beliefs we may have previously held? In 2019, we consulted over 800 residents in Peterborough City and County to better understand our community's relationship to cannabis and identify areas of interest for helping professionals. Here are 3 noteworthy results. These statistics give us a helpful picture of where our community stands on cannabis use, their feelings about its harmfulness, and the need for increased cannabis education. In the wake of cannabis legislation, Canada's lower-risk Cannabis Use Guidelines were developed as a way for people who use cannabis to reduce the potential for harm, and for people who don't to become aware of the risks associated with cannabis use. The guidelines are intended to present evidence-based information in a neutral manner that does not stigmatize people who use cannabis. We wanted to assess how successful the guidelines had been in achieving this goal, so we asked our participants to provide their feedback. Overall, most participants felt that most of the language used in the guidelines was not stigmatizing. However, points 1 and 10 were seen as redundant and slightly stigmatizing. If someone comes in and is honest about their use, telling them to stop using will probably close the door on further conversations. On more than one occasion, participants mentioned that point number 9 should be separated into 2 points. Regarding point 5, participants wanted more information on safer ways to consume cannabis. Points 3, 4, and 6 were observed as the most achievable guidelines. Point 2, 7, and 8 were the next most achievable guidelines. These points may be useful for starting conversations about cannabis use with patients and clients. The data shows us that society is shifting. With legalization, perceptions around cannabis use have been changing. While most understand that this change is happening, it can be difficult in times of change to know the best ways to help remove the stigma surrounding cannabis use. Throughout our research process, some people said that they don't like to discuss their use of cannabis with helping professionals because of stigma. Some told us that they become more reluctant to discuss cannabis use when they feel that the negative effects have been exaggerated. These results raised the question, how do we have more productive conversations with patients and clients about their cannabis use? Asking questions to better understand where our patients and clients are at and supporting their choices with accurate, non-judgmental information will help them make more informed decisions suited to their individual needs. Asking, what's important to you right now? Or, what goals do you have and how can I support you in achieving them? Can reduce stigma and build trust. Simply knowing that someone uses cannabis provides an incomplete picture. It doesn't tell us anything about their needs. To help people, we first have to learn and respect their choices. Approaching people with openness, non-judgment, and respect, meeting them where they're at, opens the door to more productive conversations and stronger relationships. We can all play a part in reducing the stigma around cannabis use, and when we do, our community will be safer and more inclusive for all. Let's ask ourselves, what can we do today to take the next step towards achieving this outcome?